My name is Mary Stokes and I'm an OB-GYN physician with CHRISTUS Women's Health. I'm originally from Miami, Florida, and it's a wonderful place to be from and grow up. Just loved the diversity. I loved being close to the ocean. We were about 15 minutes away from the beach. Definitely prefer hot weather to cold weather. So the long summers didn't bother me and the nice mild winters were great. So I love Miami. It's a great place to grow up. And I love San Antonio, but I do miss the ocean living here. It's hard for me to pick just one person in particular, but I would have to say my parents as a unit have had the biggest influence, mostly in terms of encouraging me in my pursuit of becoming a doctor. Just really wanted to see the world, make a difference in the world. Went to Africa for a couple of years teaching English, and my time in Africa really inspired me to become a doctor. And throughout all of that kind of transitional wandering time in my 20s, my parents were nothing but supportive of my dreams and when I wanted to make this pretty big career shift, really supportive of all that it took to start training, to enter residency, and then to get to this point today. I decided to pursue a career in medicine when I was actually an English teacher working in Kenya. I taught at an international boarding school that was next to a hospital. Every weekend I would go with a group of students down to visit patients at the hospital and just really kind of fell in love with the children and the moms who were there taking care of the kids, and really just began to see all of the incredible needs that especially the moms had in not having access to good health care. Through that experience, I decided, you know what, I'm going to stop teaching English, go back to school, go to medical school with the dream of both going back to Africa to help those women and really just any women who need access to quality health care. I love that we get to do a little bit of everything in medicine. So we get to be in the operating room, we get to respond to emergencies, we get to have long-term relationships with our patients when they come back every year for a well woman exam. But most significantly, I think I love the relationship that you build with women. You're really with them through some of the most special and significant times of their life, with the birth of their children. You're with them through some of probably the hardest times of their life, whether that's through loss or through a diagnosis of cancer or through a big surgery. And just really being able to sort of walk alongside them through those difficult transitions and also encourage them in times of health and joy. I really hope that I can come alongside my patients as kind of an educator, helping them to understand their pregnancy, helping them to understand what life will look like after pregnancy or in menopause, help them to understand what all their options are for improving their health and just making them strong, healthy women.